Autism spectrum disorder. What is it? What causes it? Who's got it? And what do you do about it? Autism is by far one of the most talked about and diagnosed neuropsychological diagnoses that we're seeing these days in children. And there are very few topics in medicine that have more misinformation and scientifically absent ideas circulating around them than autism. So this is part one of a multi-part series discussing comprehensively everything you need to know about autism. I'll cover what it is, what we know about what causes it, how we accurately diagnose this and how we don't diagnose it, and finally, what evidence-based things can help children who are diagnosed with autism spectrum disorder to meet their maximum potential. But first, let's start with what is autism spectrum disorder. Depending on what study you trust, anywhere between 1 in 40 to 1 in 500 children in the United States are diagnosed with autism spectrum disorder. And that is on the rise. But it's not just on the rise because it's happening more, it's on the rise because we're diagnosing it more. Most of the new autism diagnoses are because of a standardization of the diagnosis of autism spectrum across all medical specialties and psychological specialties. It means everybody's using the same set of behaviors or delays and calling them the same thing. Other children who carried other diagnoses that weren't as accurate, like general developmental delay of unknown origin or speech delay of unknown origin, are actually being accurately diagnosed with autism spectrum disorder. This also includes other diagnoses which have a completely different name, like Asperger's syndrome, that now fall under autism spectrum disorder. This inclusion increases the number of autism diagnoses, but just makes them under one spectrum instead of separate disorders. Classical autism spectrum disorder presents with three main attributes that we can recognize. Number one is atypical or delayed development of social communication, like talking. Number two is atypical or abnormal social interactions, like not being able to read facial expressions or understand social cues. And number three is repetitive patterns of behavior. Now, one critical component of accurate diagnosis of autism spectrum disorder is that these things do present early on in life. But many of the children will not present with these symptoms in the first year of life. In fact, most children with autism spectrum disorder have totally normal development throughout the first year, and between year 1, 2, and 3 is when we start to see delays or even regression of previously conquered social interactive skills. So these kids oftentimes do present between year 1 and 2 of life with significant verbal and speech delay. But in addition to speech delay, they often demonstrate an absence of social development. This can present as the absence of stranger danger between 1 and 2, or that they never make an effort to make eye contact or give and take smiles in that first and second year of life. Finally, children with autism spectrum disorder oftentimes demonstrate extreme variations of normal toddler behavior. Let me give some examples. Normal toddlers will oftentimes have some repetitive behaviors like banging their heads or wringing their hands or walking on their toes, but kiddos with ASD oftentimes will do that more often than they'll do the non-repetitive behavior. Or many toddlers will have problems with trying new foods or with textures, but kiddos with autism spectrum disorder will have extreme inability to have any type of variation in their routine and are extremely selective with their food or textures. Again, toddlers oftentimes do have hypersensitivity to light or sound, but children with ASD will have extreme sensitivity to loud sounds or visual stimuli and will oftentimes avoid situations where those are going to be present. This is what makes an accurate diagnosis of autism so difficult, is because so many of the behaviors that we use to diagnose autism are in some way or sort extremely normal in toddlers, and it's only the extremes of those behaviors that present as a disorder. Additionally, there are many other disorders that will have a piece that looks like autism, but is actually a completely different diagnosis, like some of these. And the reason it's so important that we get the right diagnosis for the right child is that these disorders have very different treatments than we would for autism. And if we get the wrong diagnosis, we get the wrong treatment and we don't help the child. So how do we screen for and make sure we have the right diagnosis? Well, we'll catch you in part 2.